So good afternoon, everybody. Thank you for joining us once again in this community chat out of Montefiore Nyack Hospital. And today, the topic of the day is home care. And our panelists today are going to be sharing tips for those people who are caregivers, but also people who are thinking about having relatives use home care. So today we have Jean Mcintyre and Ben Mazur. They both work here in Montefiore Nyack in the home care program. And I'm just gonna Jean introduce herself and tell us a little bit about what you do.
Sure. So my name is Jean Mcintyre. I am Director of Patient Services at Montefiore Nyack Homecare. I've been here for about 16 years. I was a clinical manager for 10 and most recently hold the dual role of Director of Patient Services and Clinical Manager, and have had a long history of working as a visiting nurse. I've worked in case management, hospice, and worked as a home care liaison. And I oversee the day-to-day clinical issues. I work with the clinical managers, the staff, to be sure that we provide the best care we can for our patients and families. Mm-hmm. Thank you for having me.
Of course, Jen. Ben, would you like to tell us a little bit about you?
Sure. Thank you for having me as well. So I am a speech therapist or speech language pathologist. I've been working in this field since 2014. I currently work both for the home care division and I also work at times at Nyack Hospital itself. I also have experience working in acute rehab centers and skilled nursing. And I'm happy to be here.
Okay, thank you so much. So as I said, we're going to be talking about home care and we're going to be sharing some tips, learning about what this is all about. And just to our attendees, don't forget that this is a time for you to participate. So if you have any questions at all about home care, this is your opportunity to actually bring the questions to experts who can really answer all your doubts. So use the chat box, use the Q&A box, any way that you would like to communicate with us. And I'm gonna make sure that you get answers to your questions. So in the meantime, and while we start getting all the questions from our attendees, Jen, let's start with you. Can you explain a little bit about what home care is all about?
So home care is about helping patients and families manage their either chronic or acute conditions at home successfully with a variety of services and to keep them home, to prevent hospitalization. That's what home care is about. It's a very holistic approach with a variety of clinicians that are there for the patients and families to take care of them at home.
Mm-hmm. And, you know, we've had sessions before that have talked about palliative care, hospice, and they also, I feel they also take care of people at home. So what would be the difference between home care, palliative care, and hospice care?
So hospice is a program that can be home-based or can be in a facility, and that's for an individual who is determined they have a terminal illness, and the prognosis is usually 6 months or less, and that's per the physician. And they provide a lot of services to be sure the patient is comfortable and has all their needs met. Palliative care is a program that's designed to help manage symptoms that people may have from their disease. They're not necessarily terminally ill, but they have acute pain or respiratory symptoms, and palliative care helps them to manage those symptoms. Home care, we may have people who are terminally ill. We may have people that we manage symptoms for, but we also have a variety of patients with needs like wound management or help them learn about their congestive heart failure. So that's the difference between the three.
Okay. And how do you enroll people in home care?
A physician has to refer you to home care. But if you're in a facility, say you're in a hospital or a skilled nursing facility, and you would like to have home care when you're discharged, you can talk to a case manager or a social worker, and they'll guide you through the home care process. If you're home and you'd like to investigate home care, you would contact your physician and they would make the referral for you. The referral has to drive that referral for a patient for home care services.
What is a good patient for home care?
Many types. Most of our patients do have at least some support, maybe one family member, a spouse, a son or daughter, but there's no real mold. We see people from all walks of life, all types of homes, all types of caregivers or no caregivers, but they're able to manage with our support. It just depends.
Mm-hmm. Now, let me ask you something. Do you see also patients at home, that need, for example, that are on a ventilator or things like that, or that's exclusively for the hospital?
We have had patients that are home on vents, and we may be there for other reasons, because if someone comes home on a ventilator, the family member or caregiver is trained prior to leaving the facility, because it's a very unique and, it's a serious situation. So the
Right.
caregivers are trained before they leave,
Mm-hmm.
so that they can manage the vent. And then we may come in to support and teach them about other things, such as they may have a feeding tube as well. They may have a wound that needs management. So we are in those. It's not that they're not as common, but we are in those situations as well.
Mm-hmm. Okay, so we also know about people who provide the home care, not necessarily nurses. So what will be the difference between the home care out of a hospital and, home care with people that have been trained just to take care of the patient, accompany the patient?
Do you mean if someone has a private caregiver at home?
Yes.
Like a homemade that might be with them for 8 hours a day.
Exactly.
So many people do have that. They may either be privately paying for someone to be there for that length of time,
Mhm.
or they may have Medicaid, so that they have set up an aid through a Medicaid long-term program.
Mhm.
Our service, it's intermittent and it's acute care home care. So our clinicians are there for, say, so many weeks, depending on what's going on. And our home aides are in the home for about an hour and a half to an hour and 45 minutes, because their skill is helping with bathing and showering, and they go house to house. So it's a very different model.
Mm-hmm. Mm-hmm. Yeah, I think that it's important that people know the difference, so you provide more professional services, I guess, right?
Well, we have our nursing, we provide PT, OT, speech, medical
So
social
physical
work,
therapy, occupational therapy, speech.
speech,
Yes.
medical social work,
Okay.
and home health aid. And then we also have a wound ostomy nurse as a consultant.
Mm-hmm. Now let's talk about COVID a little bit, because unfortunately, it's like we have to bring up COVID, and you guys are going from home to home.
Mm-hmm.
So what precautions do you take, obviously for the patient, but also for yourselves?
Mm-hmm. So right now we receive our guidance for our PPE from the CDC and from Montefiore Nyack's infection prevention program. Sue Stone's been really great working with us. So as of current day, our clinicians wear masks, and they wear either goggles or face shields. They protect their T-zone, very important, on all home visits. That's the standard for any visit. They practice meticulous hand hygiene and bag technique, so that they're not bringing anything to a patient's home or taking anything out with them. And before they go to the patient's house, they do a phone screening. They call them before they visit and ask, has anything changed? Is anybody in the home sick with a fever, not feeling well? Because the screening can help them determine if they have to elevate the amount of PPE they're going to wear beyond the normal PPE. And then when they're in the house, our patients, if they're able, most of them will mask for the clinician during the visit. And we've asked that one family member be in attendance during the visit with a mask to eliminate, too many people around and in a small space.
Mm-hmm. Jean, what about pets? People might have, I don't know,
Love
snakes in the house.
pets. So what happens with pets is we teach our clinicians when they first come on to home care working and they're not maybe familiar, we ask them to check with the patients and families. If they have a pet, we ask them to try to put it in another room during the visit, say a dog, or I've even had birds on home visits and things happen. And it's really for a couple of reasons. One is not all clinicians may not be comfortable with dogs or cats, but also it's an infection control issue as well. If you're performing wound care, the clinicians all have field bags. They're opening their bags with their tools of their trade, and you don't want someone's dog putting their face in your bag. So we ask if they could put the animals away during a visit, and most people are very good about it.
Mm-hmm. Now, how has the vaccine mandate affected home care?
Well, we're very fortunate that all of our field staff and all of our office staff are fully vaccinated, 100%. So we're very grateful. We have not had anyone that's had to go out on leave or to resign because of the vaccine mandate in New York State.
Mm-hmm. Oh, that's great. So everybody can be certified.
Everyone is, all of our staff is 100% vaccinated.
Mm-hmm. Can you now give us specific examples of how you can help patients and families? Maybe talk about, some of your patients and how you help them.
Mm-hmm. Yes, I'll describe some of the services and then I'll segue so that Ben can speak about his specific field, speech therapy. So we offer visiting nurses. A big thing is medication reconciliation, teaching patients how to take their meds appropriately, the right dose, the right time. Maybe they need help learning how to do a pre-fill schedule. Nurses educate and assess patients who have CHF, COPD, hypertension, pneumonia, so that they learn about their disease so that they don't get rehospitalized. They do simple wound care, complex wound care, wound vacs, Pleurax strains, urinary catheter changes. They do a variety. Visiting nurses are generalists, but they know a lot about everything. The PT, OT, they assess your home to see if it's safe, if they can help you reconfigure so that you move safely in your house, that you're comfortable. They'll set up a exercise and strengthening program if it's appropriate. They might encourage you or try to help you order equipment that will make your life easier. They will try to teach you to dress more independently or easier, get in and out of showers with equipment if you need a shower seat. If someone wants to work on stair training, they will work with you on that. They're wonderful. We have great rehab department as well. And we have a social worker if you need help with long-range planning, if you need short-term counseling, if you need advice how to navigate Medicaid, get in touch with an elder care lawyer. If you have food scarcity, if you have inadequate housing, our social worker will try to work with you on a variety of issues. She knows so many services in the community. She will connect you as best she can. We have our home health aides, and their focus is helping with bathing, showering, skin care, getting dressed, making your bed, change your sheets if you need, and maybe helping to prepare a light snack or a meal. And that's the bulk of our services, and plus our wonderful speech therapy with Ben.
Okay, so thank you for that. And I might get back to you, Jen. But Ben, what do you do? Tell us how you help these patients.
Yeah, it's a funny thing because I'm called a speech therapist, or sometimes people say speech language pathologist. And what people in my profession do, especially those of us who work in healthcare, is much broader than just the word speech. So there are a few areas where we work to help people. One of them that includes speech is communication. So if people have difficulty communicating, which can be because of an issue with speech, certainly, but also, for instance, people who have had strokes and have difficulty finding their words, who have aphasia. That would be another example where we help with communication. In some cases, we help people, or we help at least the caregivers of people who have dementia in terms of improving communication with somebody who has difficulty communicating for that reason. And alongside communication is also the issue of cognition. So sometimes after a brain injury, whether it's a stroke or traumatic brain injury or something else, people may have changes in their ability to pay attention or make decisions or remember things. And there again, we can help people out. So this goes way beyond just how people are talking, because I think mostly when people hear speech therapy, they think of the person in school who helps a child pronounce words. And that can be part of what somebody like me does, but there's a lot more. And then the other big area where we help people out is in the area of swallowing. So speech therapists are the experts in terms of helping people with swallowing difficulties, which can take place for many reasons. Generally, it's because of something neurological going on. The population, which is quite large, of people with dementia, a lot of people develop swallowing problems over time, but also, again, people with brain injuries, also people with conditions like Parkinson's or multiple sclerosis, and there can be other reasons too, but we try to help people out who have changes in their swallowing skills.
Mm-hmm. What are some of the challenges that you face working with these patients at home?
So, I mean, there are all sorts of potential challenges. One thing is that, you know, my population, more so than physical and occupational therapy, most of the people I'm working with do have trouble with communication. And so there are some cases where I'm working with people exclusively on swallowing who don't have communication trouble, but a lot of those people do too. And so, you know, just to get things rolling and make sure that people are participating and understanding what it is that I'm recommending can be a barrier sometimes when people have difficulty communicating. Now in home care, most of the time, there's also a caregiver there, whether it's a family member or somebody who's been hired to help. But I would say that's, you know, still something that that I have to work with most of my patients.
Mm-hmm. Now, you just said it that you work more, you know, like most people think, oh, a speech therapist is for children. So, and do you work more with children or with adults at your current position?
At my current position, I don't work with children. So the home care agency, we're just providing help to adults. And it's funny because, you know, people know that I'm a speech therapist, maybe, you know, people I've met in where I live, and they'll ask something about their kid, and I don't know anything anymore. I learned some things in graduate school, but that's several years ago. And my whole career, I've been working with adults, sometimes an adolescent who's being treated medically as an adult, but yeah, children is not my area.
Mm-hmm. So what would be the ideal candidate to refer for speech therapy?
Oh my gosh. I mean, there are a lot of them, that's for sure. But I'm really glad you asked that, because I think that it's an area where not just lay people in the community, but also actually a lot of physicians aren't always making referrals for speech therapy when it could be beneficial. So certainly anybody with a neurological condition, especially a new neurological condition, should probably have a speech therapist come in and at least look at how things are with communication, swallowing, and cognition. Definitely anybody with a degenerative condition such as Parkinson's or multiple sclerosis, a lot of those people, and this is something I'm very passionate about, a lot of those people, from the day they're diagnosed, they're being referred to physical therapy, but they may not get referred to speech therapy ever, or maybe not for several years. But we can even sometimes be helping people where the symptoms are barely perceptible, and yet changes are occurring kind of beneath the surface. certainly anybody who has swallowing problems, it's something that should be looked into, even if we don't know why they're having swallowing problems. A speech referral would be appropriate. And then, yeah, I mean, anybody with any kind of stroke, traumatic brain injury, or anything to that effect, for sure should get a speech referral.
What are some of the symptoms of swallowing problems?
Mm-hmm. Well, so one way to think about it is there are two issues that people can really have when they are swallowing, two problems they can have. One is if it's hard for them to eat enough because it's hard for them to get food down. Maybe it's staying in the mouth, maybe it's coming out of the front of the mouth. Mm-hmm. Maybe it's even sticking in the throat or the chest, in the esophagus, but they're not able to eat enough because of a swallowing problem. The other thing is where the swallowing may not be safe. And so that's what most people would say if things are going down the wrong way, right? Which happens to everybody sometimes. But if it's happening a lot, that can be very unsafe, because down the wrong way, what we're actually talking about is towards the windpipe and then potentially down to the lungs instead of the stomach. And if you've got food or drink going into your lungs instead of air, that can cause a pneumonia. And it's a common problem, especially with people with neurological diagnoses. So the business with having trouble getting the food down, usually you can see that somebody's not eating enough, it's staying in their mouth, it's coming out of their mouth, or they're complaining that it feels stuck. When it comes to the other business with food going down the wrong way or drinks going down the wrong way, looking for more of the symptoms of people frequently coughing or clearing their throat, or, saying that, yeah, it just feels like stuff gets stuck here. Well, that could be a sign that it's actually not even really going down the right way, and it's something we should look into.
Mm-hmm. Now, either you, Ben, or Jean, I feel like more and more people now are starting to suffer with mental illness, depression, dementia. How can home care help patients like that?
We probably can both answer that. From my end, we try very hard to screen for that. When we first have somebody on our program, we screen for depression. And even if it arises later on in the episode when we're caring for an individual, we immediately let the physician know first what's going on. And we do refer to our social worker as well to help guide us so that we can, help them to feel better.
Mm-hmm. Ben, do you have anything to add?
No, except, what Jean said about our letting the physician know. I mean, I do think that sometimes when a home care agency comes in, we do discover problems that may be new or may not be new, where people need help of one kind or another. And mental health is one of those areas. And yeah, it can be helpful for home care clinicians to give people a nudge to get help in whatever area it is.
Mm-hmm. I always like to close with something inspirational and nice, like a nice story. So I'm going to ask each one of you to think of a patient that, you feel you made a difference, and just, if you don't mind, sharing that story and how home care helped that patient.
Well, I can think of a story that during the pandemic, I think it was mentioned in one of the newsletters, but this is actually, it happened a lot of times with different families where during the pandemic, the nurse or the therapist would go to the visit, but the whole house was sick. The patient that we were caring for, but then the family members were up in bed too with COVID and couldn't help their loved one. So the clinician was trying to help everybody in the house, trying to bring food back, go to the grocery store for the family, just to get them over that rough patch. And so we have a lot of stories like that. Our clinicians really, all of them, really go the extra mile and very caring, very warm. It's a very good group. So we have a lot of stories like that, but that just came to mind right off the top of my head, how we really had to embrace whole families and do interventions to help get them all back on board, during the pandemic.
Thank you, Jen.
Mhm.
Ben?
Yeah, I mean, I've had a few examples where somebody has been at home, an older person, and at some point along the line, somebody told the family that person's liquids, what they drink, should be made thick, which is sometimes an appropriate intervention, but sometimes it gets recommended without, I don't know, without really testing out whether that's needed. And maybe sometimes it gets recommended when it was appropriate one day, but then that carries forward, right? And so I'm thinking of a particular case where it was an older person and they weren't drinking anything and it made them at risk for urinary tract infections and they're spitting out their thickened liquids. And I wish that I'd been brought in sooner, but I was happy to come in because clearly this was a swallowing problem. You had somebody who was on a modified diet with thickened liquids who was refusing to drink the thickened liquids. And we were able to work to get her back to regular drinks and to enjoy drinking coffee, right? To enjoy drinking the things that she liked to drink. And also to be, along with the quality of life, it's more healthy. We all know that we need to be drinking and she wasn't drinking anything. So it was a rewarding experience because we really turned the corner with something that was a big problem for her that could have become a bigger problem.
Mm-hmm. Is home care covered by insurance? How do you pay for home care?
Yes, most insurances cover our services 100%. Medicare covers all of our services, and a variety of insurances cover. So when someone's referred to our program, our intake department and our home care, the insurance liaison, they check your insurance for you, and they would let you know in advance if there was any copay or deductible before you even come on the service.
And Jen, what are some of the benefits of home care? Why to choose home care over going to the doctors or the hospital?
Well, the doctors, we want our patients to go to the doctor. So we work in conjunction with the physicians. So for instance, people come home so sick now that we're often the ones saying, please make your appointment. Please make your first appointment and bring your med list with you, because you might have had a hospitalist taking care of you, but your own physician doesn't know what's going on. So it's a win-win if we work with the physician, and then our goal is to keep the patient home, to keep this person home. So I think that's what we do best in conjunction with the doctor. I think some people do need to go to rehab for short term, maybe so that they can be home in a safer environment. But I think home care has everything to offer. If it's for that patient, we have everything we can offer as far as all the services.
Okay.
I'll add a little piece that's specific to rehabilitation. So with physical and occupational and speech therapy, if somebody needs our services, optimally, really, they should be going to an outpatient clinic. But when we're working with them, it's when they're not ready to do that yet, when they're still considered homebound. And so, what we want to do is get them stronger, get them on their feet, improve their skills, make them less likely to have falls, among other things. And then when they're ready to have outpatient rehabilitation therapy rather than home care, that's what we want them to do. Get out of the house, go to a facility that has more equipment, right, for physical therapy and that kind of thing. But it's an important bridge when somebody comes home from the hospital and they're not yet capable of getting themselves to outpatient therapy or being brought to outpatient therapy. We want to make them stronger so they can do that and ultimately, restore as much independence and function as they previously had.
Mm-hmm. For how long can a patient be in home care?
Depends on what's happening. So the episodes are 60 days, but we follow, the physician gives us our orders for frequency. And let's say we're out managing a wound, but the wound hasn't healed yet. So someone could be on the program a month, someone could be on for 2 months or longer, as long as we're taking care of a skill or a specific issue and it's not stabilized. So it can vary.
Okay. What's the longest patient you've had?
I'm trying to think, probably someone could be close to a year or more because they might have a catheter that it's indwelling and it's going to stay there for their life, and it may need to be changed monthly or as needed. So it could be someone like that relies on the nurse to come and change the catheter every month, or a certain type of procedure that they can't learn it or manage it and they can't get out. So we come to help them.
Excellent. Well, thank you. Thank you so much. I feel that I learned about home care. You know, you think you know, but you don't know everything. So this was great. It gave me a very nice impression of what it is. And I thank you for being here and sharing your stories and sharing what you do every day. So that's amazing. So thank you so much. I'm gonna just
For having us.
Thank you, Sandra.
Thank you.
I'm just gonna quickly share my screen here. Can you see this? So these are our next events. So next week, we're going to be having our diabetes symposium. It's called Diabetes Head to Toes. We're going to have, it's gonna be from 8 o'clock in the morning until 3:30 in the afternoon. So we'll be Zooming all day long with different doctors, different specialties. They're all going to be talking about how diabetes affects the kidneys, the skin, the toes, the heart, everything. So it's going to be very interesting. And then on November 18, we're going to have Cómo tratar la diabetes de la forma más sana y efectiva. It's all going to be in Spanish for our Spanish audience. And on the 25th, we will not have a community chat because we're going to be celebrating Thanksgiving and eating a lot after all these diabetes talks. I don't know how that goes. But hopefully nobody needs home care after that. And these are some
Okay, send him our way.
And these are some of our community events for this month. You can see it's November is diabetes month. So we have a lot of diabetes related events. We have the diabetes self-care program, Mamás Maravillosas, that is diabetes education for Hispanic mothers, diabetes education and screening. We're going to be celebrating the 100 years of insulin. And we're also going to be on Saturday, November 13 from 10 to 3 at the Nyack Library for a health fair. We're going to be participating in a senior fair at Rockland Community College on Thursday, November 18 from 9 to 3. And we every month have diabetes support groups that you can attend. So lots of things happening in the community. We're going to be a little bit everywhere. And I guess that's all for today. So thank you, Jen. Thank you, Ben. Nice to see you. Nice to meet you. Thank you for sharing your knowledge with us. And hopefully we get to inspire a lot of people out there to know that this, it's a great service that we can, you know, use. So thank you. Thank you, everybody. See you next week.
Thank you. Thank you.